Is Joe Biden abandoning the promised public option? CNBC is now reporting that Joe Biden's new American Families Plan does not include the promised expansion of Medicare eligibility, and it doesn't include a provision allowing the program to negotiate prices directly with drug companies. Dozens of Democratic lawmakers, CNBC writes, have urged Biden to include these provisions in the second piece of his economic recovery plan. Biden's plan would make permanent premium cuts for people buying insurance on the individual market. Key Democrats are aiming to include a public option bill or create a separate one now that Joe Biden is not including it in his recovery plan. Democratic Senators Patty Murray and Congressman Frank Pallone are going to write a bill to create a public option. President Joe Biden did run on expanding the public insurance market, but this is not in any of his plans so far. Republicans have opposed every effort to expand government managed health care. Democrats would likely have to look at doing this either via a budget reconciliation bill to pass it without Republican support, because you're not going to get Republican support for a public option, or convincing Joe Biden to put it in one of his plans, including possibly the American Families Plan. There are lots of Democrats absolutely furious with Joe Biden for not including this, and I understand that, and I'm with them. Now, you know that on this program, we are pragmatic, and I would like to see the promised public option done now. I would like to see it done last month. I would have liked to see it done when Obamacare was first put together. I could understand if you said to me, the inclusion of the public option will never pass if you make it part of this bill. And so it makes sense for Joe Biden not to include it. I'm just not convinced of that yet. I have not seen evidence that if Democrats hold firm and go to Joe Biden and say, listen, Joe, Republicans don't want the public option. OK, we're going to need to pass it via budget reconciliation if we're to do it outside of this. Let's just include it. Let's just include it now. And if we do this all via budget reconciliation, then we get the public option done. And let's actually put Republicans in a position to vote against all of this stuff. Now, the counter would be if you don't have all 50 Democrats on board in the Senate, then it's not going to pass either way because you're not going to get a single Republican vote. So this is one of those situations where there's truth to both sides. Do I believe that if Joe Biden doesn't do the public option now, he never does it? No, I think it's possible that Joe Biden would try to do it later on. But why wait? Why wait? There is no better time than now to do something. And remember, the public option was the starting negotiating point with Obamacare in 2010. We should have had or 2009, whenever the negotiation started. We should have had a starting point that was far more progressive with Obamacare. The first thing to go was the public option with Obamacare. Is it possible Joe Biden will do this later? Sure. Yeah, maybe. Let's just do it right now. But you've got to have all 50 Democrats on board. It is not completely clear to me that you have them. So are the criticisms fair that it should be done now? Absolutely. Is the criticism fair that this is evidence Biden is permanently abandoning the public option? No, we can't say that yet. We're 4 months into a 4-year term. That being said, my preference would be to do this right now. There is no reason to wait unless you don't have all 50 Democrats on board. You've got to fight for their votes. You have to negotiate with them. OK, if we find out that it is 3 Democratic senators that don't want the public option, and were it not for them, you could do all of this via budget reconciliation, I would say you've got to bring those 3 people. Joe Biden brags about being able to negotiate. He brags about being able to get deals done with the other side. Well, get a deal done with your own side. Get those 3 hypothetical senators who don't want the public option in the American Families Plan. Bring them to the White House and convince them. Negotiate with them. Do the thing that you ran on being able to do as a diplomat and an elected official and a deal maker in the Senate for a long time. Could it be done in 3 months? Could it be done in 6 months? Could it be done in 2022? Sure. But I would like to see it done right now. And until I see evidence that it couldn't be done right now, I believe we need to continue pushing for it to be done. Now, many of you will write in and say, David, this is pathetic. You just got to do Medicare for all. Many Democratic senators don't support Medicare for all, and neither does Joe Biden. Medicare for all is not going to happen right now. OK, so what's on the table is, can we get a public option done? an idea would be get some Democrats to lobby for Medicare for all in this bill and negotiate to a public option. I would be open to that. What I don't want is something that has no chance of passing if that's the case. We don't know that to be the case yet. If there's no chance of passing, there's no point in holding this bill up indefinitely. But I've not seen the work done yet that proves to me you can't force a public option into this bill right now. If you disagree with me, let me know. And we'll have more coverage of this on our Instagram page, which you can find at David Pakman Show on Instagram. While you're there, follow me on Instagram at david.pakman. If you are anything like me, you probably aren't thrilled with the idea of going into a doctor's office right now. And thankfully, there's a practical and affordable way to take control of your health and get personalized care from the comfort of your home. It's a service called SteadyMD. They're one of our sponsors. You take a quiz, you get matched with a licensed primary care physician who understands your health needs. You have a 1-hour video call with your new doctor. You establish a meaningful relationship with them. And after that, your doctor is available to you anytime by text, phone, or video chat. This is not a random doctor on call. Each doctor at SteadyMD has a limited number of patients, so they actually have time to listen to you. You get the personal attention that you deserve. They can do almost everything an in-person doctor can do: perform medical evaluations, talk to you about health concerns, send prescriptions to your home or local pharmacy, and anything they can't do online, they'll quickly set you up with an in-person provider to do, things like blood tests, as an example. You don't need insurance. It's only $99 a month with no other fees or copays. There are so many practical advantages to using SteadyMD for primary care, and it's also so much more affordable. Go to steadymd.com/Pakman to take the free quiz, see which doctor is right for you. I took their quiz. They matched me with a doctor who specializes in my particular health needs and situation. The doctor they gave me is a really perfect fit for me and my medical needs. There's no risk, no commitment to get started. Just click the link right underneath this video.